Today, we're going to address some of the common myths and misconceptions about oral hygiene. It's a wonder how these things get started, and it's also amazing how many people actually believe what they hear without checking the facts. Patients already have 1,000,001 excuses why they don't do this or they don't do that to take care of their teeth. So, let's try to reduce that number by clearing up some of the more common myths and misconceptions once and for all. Myth number 1. Bleeding gums are not a big deal. On the contrary, bleeding gums are a sign of periodontal disease. However, many patients seem to think it's okay to see blood when they brush or floss. I mean, sure, you might see a tiny bit of blood when flossing, especially in patients who don't floss regularly, but it's certainly not normal. I asked a hygienist friend of mine what she tells patients who don't seem to think bleeding gums are a problem. She tells them this: if your hands started bleeding when you washed them, you would know something was wrong, and you do something about it. Same goes for your gums. Myth number 2. Pregnant women should skip professional dental checkups. So false. Our friends at the American Academy of Periodontology tell us that a mother's periodontal health can in fact affect the health of a baby. Studies have shown that an infection during pregnancy, including periodontal disease, is cause for concern and may increase the risk of delivering a premature, low-weight baby. Myth number 3. Cavities are the #1 cause of tooth loss. Most patients would agree with this, but we know better. We know that most cavities can be stopped at their earliest stage, cleaned and filled, thereby saving the tooth from extraction or needing a crown. The real answer to the top reason for tooth loss is, of course, periodontal disease. As we all know, once periodontal disease has done irreversible damage to the bones and supporting structures, teeth are pretty much, well, a lost cause. No pun intended. Myth number 4. Oral cancer only affects older people who drink and smoke. Well, it's true that people who drink and smoke put themselves at greater risk for oral cancer than those who don't. However, recent research and clinical studies indicate that a rise in oral cancer among young men and women that has nothing to do with drinking or smoking. The contributing factor is the oral HPV, a strain of the human papillomavirus that is transmitted by oral sex. There is a difference though. Oral cancer caused by the oral HPV virus is limited primarily to the back of the mouth, the oropharynx, base of the tongue, and tonsils, whereas oral cancer due to drinking and smoking is primarily found on the lips, cheeks, front of the tongue, and gums. Now, you'd think if patients knew all the facts, they'd wise up and take better care of their mouths, right? Well, as dental hygienists, it's up to us to educate our patients about these common oral hygiene myths and misconceptions, because let's face it, if not us, then who? So tune in next Wednesday for another fun and informative episode of The Desiree Show.